Many of our counseling clients have questions about what to expect at the first appointment. First of all, you're going to want to bring a couple of things to your first counseling appointment. You'll need to bring your child's insurance card so that we can get a copy of that for the record for billing purposes. You'll also want to bring first appointment paperwork. Our first appointment paperwork can be found on the Forms and Resources tab under the Counseling Forms link. If you get a chance before your first appointment, please print these forms off, fill them out, and bring them to the first appointment. If you don't have a printer or the ability to print the forms, then that's not a problem because we will have the forms ready for you at the office for your first appointment. You'll also want to bring method of payment. If you're using private insurance or if you are paying out of pocket for services and doing our self-pay option, you'll need to bring a method of payment. We accept cash, personal check, Visa, MasterCard, and Discover. And we also accept the HSA and benefits cards as long as they have the Visa or MasterCard symbol on them. At the first appointment, a parent or legal guardian must be present for the first session. We have to have consents to treat by the person who has legal custody of a child in order to see the child or teen. During the first appointment, the counselor will meet with you and your child to gather family history and background information. We'll look at what your current concerns are, what your hopes for treatment are, and also talk a little bit with you about family history, any medical conditions your child has, and also want to look a little bit at their school performance. If your child is 4 years old or older, the counselor may ask to see the child alone for a few minutes at the end of the first session. If your child's uncomfortable, then this might be held off until the second session. During this child-directed portion of the first appointment, the counselor will ask questions to get to know your child. They're very simple questions like, what's the best part of school? If you had 3 wishes, what would you wish for? Things like that, just to let the counselor and the child get to know each other a little bit better. Going forward then, the counselor will then meet with you and your child once a week in order to work on treatment plan goals. All of our counselors at Tender Hearts use a combination of individual and family counseling depending on your child's unique needs and what your treatment goals are. We only see 2 and 3-year-olds for family counseling, so if you have a 2 or 3-year-old, please expect to be at every one of our counseling appointments. The counselor will generally meet with your child once a week until substantial progress has been made. At that point, the counselor may discuss with you moving sessions to every other week, and then eventually monthly. We do this in order to make sure that your child's progress is maintained and that they are using the skills and techniques taught in counseling in their everyday life. At Tender Hearts Child Therapy Center, we promise to provide you and your child with the highest quality care. Your child's health and confidentiality are our number one priority, and we are always striving to improve our services for our clients. To schedule an appointment, or if you have additional questions, please give us a call. In the Cape Girardeau area, we can be reached at 573-803-1402, and in the Farmington area, we can be reached at 573-218-9653. We look forward to hearing from you.